Lymphedema is a chronic condition that requires management to prevent complications associated with its progression. Hi everyone, thanks for joining me today. In this video, you'll learn about the cycle of lymphedema progression and discuss the 4 methods of care that are used to manage it. We'll take a look at the role of your lymphedema therapist and begin a discussion on lymphedema maintenance and making a maintenance plan. Don't forget to check out my Pillars of Self-Care series that go into greater detail about each pillar and provide you with self-assessment methods that can help you evaluate your maintenance plan. So grab something to drink, make yourself comfortable, and let's get started. The lymphatic system has a larger role to play in fluid removal from the tissues than originally thought. Swelling has many causes. When the lymphatic pathway system is damaged or consistently overwhelmed, swelling becomes chronic and is given the term lymphedema. Lymphedema, therefore, is a chronic progressive condition of swelling that can affect any part of the body and leads to skin and tissue changes as it progresses through its stages. It can have an impact on more than your physical health and is not, as of yet, curable, but it is manageable, especially when recognized early and managed well. At the root of lymphedema is lymphatic flow disruption, causing a buildup of fluid and waste in the tissues, creating inflammation, structural changes in the tissues and skin, and shape changes of the limb. This further disrupts lymphatic flow and thus becomes a cycle that produces lymphedema progression through its stages, if not maintained, through the use of the 4 pillars of treatment. Self-management for lymphedema not only maintains the achievements made in intensive therapy, but also helps break the lymphedema cycle through prevention of injury, minimizing increases in congestion, decreases inflammation and infection rates, and minimizes skin and tissue changes and limb size changes. Traditionally, lymphedema management is divided into 2 phases, the intensive or treatment phase and the maintenance phase. Both phases incorporate the internationally recognized pillars of compression, skin care, exercise, and manual lymphatic drainage, a specialized form of massage. The intensive phase usually begins soon after diagnosis of lymphedema and can last weeks or months, depending on the stage of lymphedema. Compression in this phase is used 23 out of 24 hours a day for reduction purposes and typically includes the use of multi-layer bandages or short stretch Velcro reduction garment. Skin care may include tending to wounds depending on the clinic setting and scope of practice of the lymphedema therapist. It also includes instructions on skin hygiene and injury prevention. Exercise in both phases is tailored to each individual and may include instructions, class suggestions, or referral to another qualified healthcare practitioner. Manual lymphatic drainage massage is typically performed in the intensive phase by your lymphedema therapist. It is a light form of massage and tissue manipulation to temporarily enhance lymph flow and reduce congestion. It also includes tissue remodeling techniques to help with fibrosis and scar tissue. During the intensive phase, contact with your lymphedema therapist is more frequent, as the goals of this phase are limb size reduction, improvement of tissue and skin health, and education, including devising a maintenance plan for self-care that utilizes the 4 pillars. In the maintenance phase, time with your lymphedema therapist decreases as you become more confident in your self-care routine, and their role is more of a resource for you. During this time, you're wearing your maintenance garment, which is worn throughout the day and removed before bed. It may be a knitted garment or a Velcro garment, depending on your ability to put it on and take it off. And some will also have special night garments for night use. During this phase, you are following the maintenance plan of self-care you made with your lymphedema therapist that includes all 4 pillars for best results. Because lymphedema is not a static condition, there may be times where you may need to re-enter the intensive phase again during times of swelling flare-ups. So who is a lymphedema therapist and what is their role? Most often, lymphedema therapists are either physiotherapists, occupational therapists, registered massage therapists, or nurses who have a postgraduate certificate in lymphedema management from an approved school with a minimum of 135 hours of training. The role of your lymphedema therapist is multifaceted. They help you gain confidence in managing your lymphedema through education and are constantly upgrading their knowledge so they can provide you with the latest information in lymphedema management research. They are your connection to other healthcare professionals and can help you navigate your way through the healthcare system by suggesting any referrals you may need or by helping you find funding for your compression garments. When you first meet your lymphedema therapist, they will do a comprehensive assessment that will guide your treatment sessions. Careful attention is taken to make sure your care is safe and tailored to your individual situation. Reassessment takes place over time with your therapist as they combine treatment with education so that you can become self-sufficient in managing your lymphedema in a timely manner. Making a plan of self-care for lymphedema maintenance is important for successful outcomes. Incorporating all 4 pillars into your self-care plan is the key to breaking the cycle of lymphedema progression. Your plan will set goals and detail how you are going to implement exercise, compression, skincare, and self-MLD into your life. Your plan is then reevaluated about every 4 months when you do your self-assessment. This will help you catch changes associated with the progression of lymphedema faster and allow you to make changes. If you want to learn more, be sure to watch my Pillars of Self-Care videos that help you understand why each pillar is important and walk you through the self-assessment processes for each self-care pillar. Here are some resources and information about lymphedema, self-MLD, exercise, nutrition for lymphedema, and self-bandaging. Pause the video here to write them down or take a screenshot. Thanks for watching this video today. If you did like this video, please push the like button so others can see it too. See you in the next one.